of November every year is observed as a World Diabetic Day. It is to create an awareness about this lifestyle disorder, which is increasing very rapidly all over the world. In India, 1 in 6 adults are found to be diabetic. And this is all because of our lifestyle. Nowadays there is a lot of urbanization, and therefore our eating habits have changed. We consume a lot of trash foods, very rich in fats and other things, which doesn't contain fiber. Then second thing, most of us are used to sedentary work, so there is lack of exercise. As a result, the obesity is increasing, and obesity is the risk factor for development of diabetes. So all our efforts should be to maintain our weight within the normal range. It is not that it is only increasing in the urban population, it is also increasing in rural population. And therefore, it is necessary that we observe and we actively change our lifestyle. We actively change our diet habits and do regular exercises so that we can prevent this lifestyle disorder that is diabetes. Diabetes affects all the organs in the body. It can affect the heart, and therefore all these coronary artery disease, hypertension are more common with diabetes. Diabetes also causes what is called as a cardiomyopathy. Diabetes can affect the kidneys. And as many of you are aware, once there is a kidney failure, then the person has to go on lifelong dialysis, which is so cumbersome, or for a renal transplant. You must have seen many people, they developed a diabetic foot and therefore the foot had to be amputated. Diabetes affects the eyes and therefore the vision is affected. So almost all organs, the sexual functions are affected, the bladder is affected, many things. And therefore prevention is always better than cure. There is no cure for diabetes. Today, at least, we can keep it under control with first our diet modification and second by pharmacotherapy, drug therapy. And when the oral anti-diabetic drugs are no longer acting, then every patient is now subjected to insulin therapy. Please consult your doctors. Do your regular checkups. If the diabetes is detected, consult your doctor. It is not a stigma, but if you control it, you have a normal lifespan without any complications. Diabetes in pregnancy is one great problem. Our marriageable age somehow is increasing these days. Most of the girls who are educated, they are career-minded, they postpone the marriages, and therefore the conception takes place at a very later age. The chances of them developing what is called as a gestational diabetes is high. And when a mother develops diabetes, it is the mother and her baby which is growing in her body are affected. Not only that, the obstetric outcome is affected because the diabetes itself can cause miscarriages, abortions, congenital deformities in the children, and all this is preventable if we are conscious and aware about our blood sugar level and we take measures to control this blood sugar. So on this World AIDS Day, the theme is access to the diabetic care. So please have an access to the care. Go to the proper consultant, go to the proper laboratory, get your regular checkups, and if you are diabetic, start the management as early as possible so that you live a near normal, longer life. Thank you very much.